What age group do you think of when you hear the word arthritis?
Older, like 60s.
And old, like 50 and up.
Like middle-aged and over. Older, like over 60. Yeah, at least over 60.
Old people.
Hello, my name is Betsy Roth-Wojcicki. I'm a pediatric nurse practitioner at Children's Hospital of Wisconsin and the Medical College of Wisconsin, and I'm in the field of pediatric rheumatology, which means that I work with children who have rheumatic diseases. Juvenile arthritis, juvenile idiopathic arthritis, is an inflammatory process. Juvenile idiopathic arthritis is an autoimmune illness, which means that your immune system, which typically is there to help you fight infections or viruses, when you have an autoimmune illness, what happens is it gets a little mixed up and it starts attacking your own body. And in juvenile arthritis, it causes an inflammatory process going on. So you can get inflammation of your joints. Osteoarthritis is something that you see more with older adults, and it's from wear and tear of the joints. So it's not an inflammatory process.
The word arthritis is derived from arth, which means joint, and itis, which means inflammation. Arthritis typically affects the joints, but the eyes, skin, and gastrointestinal tract can be involved as well. Juvenile arthritis, JA, is a term used to diagnose autoimmune and inflammatory conditions in children 16 years of age or younger. Juvenile idiopathic arthritis, or JIA, is the most common type of juvenile arthritis. To be diagnosed with JIA, one must be under the age of 16 and experience swelling for at least 6 weeks or more in one or more joints. There are 3 general types of juvenile arthritis, which includes oligoarthritis, polyarthritis, and systemic arthritis. Oligoarthritis is the most common of the 3 and affects 4 joints or less. Polyarthritis affects 5 or more joints. And the big kicker, systemic, affects the entire body, including joints, skin, and organs. Thankfully, systemic arthritis is the least common of the group, but that doesn't mean that it doesn't exist. Even so, just one of these types of arthritis is difficult to deal with, and for a young child or teenager, having joint problems stacking on top of schoolwork and a social life is a tough battle to fight. Let's show you what we mean. This is Marissa. Marissa was diagnosed with polyarthritis when she was 12. She has been homeschooled for the entirety of her education. Now at 14, Marissa is entering public high school. She has a few concerns about how her arthritis will affect her academic life.
When I wake up in the morning, my joints are painful and stiff. When I was homeschooled, I didn't have to rush to get out the door in the morning, and I had a really lenient time schedule for my lessons. Now that I'm going to be in public school, I'm going to have to wake up at least 5:30 just to get a shower and some breakfast before I go out the door. Taking long morning showers relieves my stiffness a bit, but since I do have to get to school by 7:15, and I've got to get dressed, eat, and get in the car and all of that, and with the size of the school and the heavy books I'll probably receive, I'm worried that I won't get to class in time. And block scheduling, there's no way I'll be able to sit for the entire period without feeling pain and stiffness in my joints from just sitting. But the class I'm really worried about is gym. I need to take 3 gym classes to graduate, but I'm not nearly as strong as I'm supposed to be. I guess I have to talk to my new gym teacher and see if she'll be able to help.
Hi, are you Mrs. Sinberg?
Yes.
I'm Marissa. I'm going to be a freshman at the start of the school year. I just wanted to ask you about some health concerns. I have juvenile idiopathic arthritis in 6 of my joints. It's mostly in my fingers, but it also affects both my knees. This disease lessens my ability to bend my joints, and I can't do certain activities like heavy weightlifting and squatting. I was wondering if there's something I could do if the activities get too difficult.
Oh, I'm sure we can work something out. What do you do to exercise at home?
I do range of motion and strengthening exercises almost every day. I begin with my range of motion exercises first. To do this, I move each of my joints back and forth a couple times at a comfortable pace, taking note of the areas where I feel excessive stiffness. These movements help prepare my joints for the rest of the day. After that, I begin my strengthening exercises. Because my joints are weak, I have to keep my muscles strong in order to support my legs. I do low-impact exercises such as calf stretches, sit-to-stand exercises, and one-leg balances. Some of these may look a bit ridiculous when I do them, but they help to strengthen my legs and support my knees.
I think it's most important to know your limits. Whenever we do an activity, I'll let you know the lower impact alternatives to the exercise.
It's very important to stay active when you have juvenile idiopathic arthritis because you need to move your joints. Typically, what happens for our patients is if they have active arthritis or if their arthritis is somewhat controlled on their medications, they may be stiff in the morning when they first get up, and so it's a little bit more difficult for them to get up and move. But once they're moving and have maybe taken a warm shower to loosen their joints up a little bit, they're good to go.
How may the lifestyle of a family change after the child is diagnosed?
The lifestyle of a family may change for a number of reasons. Essentially, when there's a chronic illness that happens in a family and the juvenile idiopathic arthritis is a chronic illness that the patient will have always because we don't know the cause and we don't know the cure, what our goal is to put it into remission where there's no active disease. It can affect the family because there's really develops, when you have a chronic illness, not only does it affect the patient, but it can affect the whole family. In this way, an example would be if they planned a vacation and all of a sudden the patient has a very bad flare right before they're able to go on their vacation, so they have to change plans. Or it's a Sunday afternoon and they all want to go out on a bike ride, and this patient, all of a sudden their knee is acting up and they have arthritis in their knees, so they have difficulty and they can't keep up with their family. It used to be that if there was a pre-existing illness in a family member with a chronic condition, that it would be difficult for a family to change insurance companies and not have a big copay, or they would have difficulty getting insurance. Now that's changed, a federal law a number of years ago. So if a person is covered with an insurance, diagnosed with a chronic illness, and then a parent leaves a job and goes to a new job, if they're covered right away, that is covered. So it also means that if a patient has chronic arthritis, they're going to the clinic visits more often, they're on medication, they may be more susceptible to colds and flus because many of our medications can cause your immune system to make you at higher risk. They're for infections and colds.
What research on juvenile arthritis is currently being done, and what do you expect to know in the future?
We're doing research in many different areas. We're doing research now to see if there's a genetic component to it. Is there a particular gene out there that our patients who have juvenile idiopathic arthritis have that is common among them? There's also lots of research out there on the medications that we're using to make sure that we can continue to offer our patients the best medication with the least side effects. There's a whole new class of drugs within like the last 15 to 18 years called the biologics. Enbrel, Humira, Kineret, Abatacept, that have been really a life-saving treatment plan for our patients who have more aggressive disease. So there are many different elements of research going on. Obviously, we want to find out what causes arthritis, and we want to know how to cure it. But those are still unanswered completely questions that there are research going on. Here at Children's Hospital, we are involved nationally and internationally with a research consortium to utilize our information on the patients that we see here to help answer those questions. No one particular pediatric institution sees enough patients to be able to have adequate research studies to answer those questions. So we are participating on a daily basis with our colleagues over in Europe, over in South America, here in the United States to help answer those questions.
All right, thank you for your time.
Thank you.